At any given moment, our lives can change. To what lengths are you willing to go to be happy with those changes? I am Keisha, a wife, mother of two, and returning student. I have taken control over many things in my life, but this time, my change will happen under the knife. Hi, my name is Keisha Bonner, and welcome to my video journal. I'm here to talk about my decision on having an abdominoplasty and the reason why I chose to have plastic surgery versus traditional methods. I'm 29 years old and I am an active mother of two. I'm physically able to do pretty much any exercise. I used to run regularly. I go to Zumba. I love Pilates. So I am very active. I'm 137 pounds, which may not be the average BMI or within the weight standards of certain people, but it's a good size for me. I don't consider myself to be a big person. I am a little bit more on the muscular side, but I enjoy my body weight. The area that I have the most trouble with is my stomach. I've done crunches, I've done Pilates, I've done yoga, I've did every toning exercise that's possible, and nothing has worked. I've spoke with my primary care physician, and she explained to me that I was not going to lose the belly fat due to excessive amount of skin due to childbirth. I had a pretty large baby the first time around. The second time around, my daughter was smaller. However, I had her prematurely, and at 7 months, she was already 5 pounds. So she would have been a big baby as well. My decision was prompted by the way I feel in clothing. It always made me very insecure to be somewhat small frame and then to have a pouch or a pooch where others will think that I was pregnant or that I was lazy, and neither one of the two was true. I love to have fun, and I really like to be carefree. I didn't want to always think about, oh my God, is my stomach showing, or do I look fat in this dress, or oh my God, let me wear like 2 girdles so I can make sure that I look in place. You do that for a while, but then it's constantly on your mind, and you're more concerned about your outer appearance than enjoying yourself at wherever function you're at. So I decided that I didn't want to live the rest of my life with those concerns. And if this one surgery can correct that issue, then I was willing to do it. It's not a decision that everyone will make. Some people would say, oh, well, that's the way God made you. You should just deal with it. And why would you put yourself through elective surgery? Well, in all honesty, that's not how God made me. God made me pretty well, I think. If I could go back to what God had made me, then I would be happy. I'm not doing anything super extreme. I'm not getting anything done with my face, or I'm not getting any breast implants, and I'm not having any lipo done. It's just that one problem area that I want it corrected. So those are the reasons why I chose to have an abdominoplasty. It will not be for everyone. It is a serious operation. It is 6 to 8 weeks recovery time, driving time. You can't drive for a week or two. You will be under general anesthesia. You will have pain pills that are higher levels than your typical surgeries. You will be cut from hip to hip. It is something that you must consider. This is a serious operation. There are tons of medications and herbal vitamins that you take beforehand to help with bruising and blood clotting. And hopefully in my next update, I will give you a list of those and we can talk about the dosage, how often, and what those medications actually are for. You also have to make sure that you're healthy. You have to be within 5 to 10 pounds of your weight goal. It's not a surgery that is a quick fix. You have to do most of the work yourself first. Also, with the tummy tuck or the abdominoplasty, you can't exercise afterwards for between 4 to 6 weeks, depends on your healing process. You can't lift anything over 10 pounds for 4 to 6 weeks. So it's life altering for 2 months. And that's a big step when you have other things going on. If you still have a household, if you work, you will be on light duty. And those are things that you need to consider. Also, they recommend that you do not smoke. It is preferred for you to be a non-smoker, and this is due to healing. Smokers take an additional amount of time to heal. I unfortunately am not a smoker and I'm not a heavy drinker, so hopefully my healing process will be a little bit quicker. Let's see what else. You have to, there's certain things like when I went for my pre-op at the hospital, I was told that I would be intubated. That kind of freaked me out, but I know that it's there to help me breathe. Since the operation is performed in an upright position, you're literally sitting up, which also means that once you are in the recovering area, you will be continuing to slump over. You will not be able to walk upright for at least a week. It's preferred to sleep in a recliner or something that your body can easily form in a V. Let's see, what else? It's gonna be a big deal. Even though I don't want it to be, it ultimately is a big deal. My doctor is Dr. Levesque, and she is part of the Gulf Coast Plastic Surgery Group. She's a really good doctor. She came highly recommended, her and her partner, Dr. Butler. And they are one of the leading plastic surgeries in the Pensacola, Mobile area. The fee was $6,000. Which is an average fee. I started this process in the middle of February, and I began to look for doctors. I began to have consultations with different doctors, and I did my homework and my background work and found out where they studied, if they had any malpractices or if they had any blemishes on their records, to make sure, and I also made sure they were actual plastic surgeons. That is something you must be aware of. You could be just a medical doctor and perform a plastic surgery. You do not have to be a plastic surgeon. Well, that means that they never interned or had any residency in plastic surgery. That's pretty serious. I mean, being a medical doctor is, it's great in itself, but if you are going to be a surgeon, you probably want a surgeon that has residency somewhere. So that's huge, and I recommend that all future patients verify their doctor's information. Going through this process also have emotional transitions. Initially, I felt very happy and excited that something that I've wanted for over 2 years is actually becoming a reality. I was extremely excited about the process and just looking toward the end result, like, oh my God, I'm going to be able to wear a bikini and I'm going to be able to not be concerned of how I look in certain dresses. And I was excited overall. And as the date became closer, I began to feel nervous, and I began to question if I was doing what was right. I went through the feeling of feeling guilty and selfish. It's a large sum of money, and it's not funded by anyone. It's funded solely by savings. And I wondered if this was the right choice, not just for me, but for my family. I will be out of commission for 6 to 8 weeks, meaning that the household will be my husband's responsibility. And something that also weighed heavily on me is that we're a military family. And at this point of my husband's career, he's in flight school or aviation school. So he has to dedicate a lot of his time to studying. And this is still considered a major surgery. And so that means that he will also have additional loads of making sure our kids are okay, their homework is done, and dinner and the dog and so forth. I'm sure he's capable. It's just one of the feelings that I've always had or still have during this process. So it makes you question your judgment. I'm still dealing with that internally, but I do feel better that I feel like it's never going to be the right time, and this is something that I want. I've dedicated my life to my family. I've made plenty of sacrifices for my family. And if I'm going to be selfish, this one thing is what I want to be selfish for. Sounds horrible, but that's how I feel. And this is a week before my surgery, or well, my surgery is actually this week. And I'm a little terrified. I've never had surgery before of any kind. I've only been on a general anesthesia one time, and that was to remove all of my wisdom teeth. I never even had meds when I had my kids. So I've never really dealt with, I guess, like hospital drugs and medication and general anesthesia. So I'm still a little worried about that. I feel I will be okay. I feel like I'm in safe hands, but because I don't have much experience with those things, it kind of frightens me. I'm worried about the pain a little. I've read several blogs, and I've also signed up to realself.com, which is a support group of some sort for tummy tucks and other plastic surgeries. And everyone has their own opinion of the pain. So there's really not one that you can listen to, but I'm a little concerned about that. Let's see. And now I'm really concerned about the healing process. So that's emotionally where I am right now. I'm just still hoping this is the right decision, even though I'm this far into it. It's not like I can back out. So that's where I am at this very moment. I will continue to update you guys and let you know where I'm at, how I feel whenever I feel a certain way. And then hopefully I will also get to show you my doctor's office tomorrow and maybe a shot of my doctor. I have to do a measuring or a taping because I've lost a couple more pounds. And so she needs to retape me. So if you have any questions or concerns, you can write me below or drop a line after you see my video. I'll be more than happy to answer any questions that you have. Please stay in tuned to see the end process, see what a new bikini body will look like. I'm excited still. Anyway, thank you very much for tuning in. Bye.